Thank you, fortunately.
Mr. Chairman, thanks very much. Mr. Witty, good to be with you. In public statements, UnitedHealth claims that the vast majority of services has been restored to pre-cyberattack levels. You spoke about the company's efforts to make providers whole. I continue to hear, however, from providers in Pennsylvania who are struggling to serve their patients as they await reimbursement for the care they're providing. Dr. Christine Meyer, who owns a practice in Exton, Pennsylvania, the southeastern part of our state, initially looked into taking out a home equity loan to keep her practice afloat. She reached out to UnitedHealth to participate in your loan program, but she was only offered $4,000 a month, which would cover 0.8% of her monthly expenses. Now, months later, she's finally received, I should say, a more generous loan from Optum, but she's worried about the repayment terms. She said the terms are unclear, and she's worried that she'll have to pay back these loans before her practice is fully up and running. Would you commit to supporting providers like Dr. Meyer by delaying the deadline for their loan repayment until the backlog of claims has been cleared regardless of the time frame?
Senator Casey, thank you for the question. Let me first off apologize to Dr. Meyer for the delay in getting the right level of loan capacity to them. And in the effort to move quickly here, we recognize we didn't get it right always at the very beginning of this process. I think we've improved that dramatically, and that's why I'm sure she was able to get the kind of full loan she has. I'd like to absolutely confirm to you and Dr. Meyer that we have no intention of asking for loan repayment until after she determines that her business is back to normal. And even then, we would not look for repayment until 45 business days, 60 calendar days after that. And there would be no interest and no fee associated with that loan.
So it would be a determination she makes?
That's absolutely right.
And secondly, I wanted to ask you about the risks, especially when in the context of children and seniors, when the obvious risk when health care or financial information is breached. In the context of a child, the child's data is stolen. It can be a blank slate for cyber criminals to open up bank accounts and apply for loans, and it can take obviously years, if not longer, to repair the damage. For seniors, for older adults, whose rates of victimization from scams has been skyrocketing in recent years, a data breach means even more of their information is available to scammers to use against them in the future. UnitedHealth still hasn't notified any victims of this cyber attack. It's been more than 2 months, but according to the company's website, it will take, quote, several months, unquote, to identify and notify impacted consumers, or customers, I should say, and individuals. And I think it's clear that if United had stronger defenses like multi-factor authentication, then this could have gone very differently. At the same time, United is growing and expanding. It's lacking adequate and protective cybersecurity infrastructure to secure people's most private information. So I'd ask you this, and 2 questions. One is in the context of a parent. Parents who are worried about their child's personal and private health information being out there in the world for the rest of their lives, what would you say to those parents?
Senator Casey, first off, I'm very sorry that this situation has happened and there has been a data theft. We are working incredibly hard to get that information and working with regulators to get notification as fast as possible. We've also done everything we can to try and minimize the possibility of that data in fact leaking out at all. I just want to reassure any parent, any individual, already today, prior to notification, anybody in America can call us or come onto our cyber support website for change. And already the service is available to provide 2 years credit protection, 2 years identity theft protection. It's as simple as making the call to 1-866-262-5342. If you ring that number, within the first few seconds of that, folks will offer those services. It's a very straightforward thing to do, available to anybody.
Thanks. I'm out of time, but I will submit one question for the record. Thank you.
Senator Casey, before you leave, I just appreciate your standing up for families. And we're going to have some more discussion of this because I happen to think, Mr. Witty, credit monitoring is the thoughts and prayers of data breaches. This is absolutely inefficient, and I'm going to ask some more additional questions here shortly. Senator Hassan.